Okay, I am not in my patient's room yet. I am here looking at my patient chart. I have Mary Sanford of a date of birth of 11/12/98. She has no known allergies. She has a low fall risk and she has a full code. She is a 26-year-old female who just had a vaginal delivery 6 hours ago, so she needs a straight catheter put into place, and that is due now, so we are going to do that. She has had a Foley before, but not a straight cath, so I want to educate her on that. And I just want to look in her GU. She feels bladder pressure, but she is unable to void. So she has discomfort and swelling on the perineum. So I want to just assess that, make sure that she's doing okay. So now I am going to go into my patient's room. Knock, knock. Hi, I'm going to provide privacy of the door and the curtain. Hi, I'm Grace Hine. Can I get your name and date of birth, please?
Mary Sanford, 11/12/98.
Okay, and I have here Mary Sanford, 11/12/98. Okay, Mary, hi, I'm Grace. So I'm going to be your nurse today, and I am actually going to be inserting a straight catheter into you. And so that is to help so you can have your urine flow, okay? Because I know that you're having some discomfort and some swelling, and I know that it is not comfortable to be sitting there with that urine in the bladder. So what we're gonna do is drain that. And so I know that you've had a Foley before, but have you had a straight catheter?
I don't think so.
Okay, so the difference with a straight catheter is that when I insert it, it's only going to be in there for about 15 to 20 minutes. So it's not going to stay in there overnight or anything. And so we're just going to let that urine flow, and then we'll just catch it, and then we can take it out right away after that, okay?
Okay.
Okay, so now if you don't mind, I'm just going to lift up your gown to check everything with your anatomy, make sure that everything's okay of where I'm going to insert it. Is that okay? Okay.
Yeah.
I'm just going to lift up your gown. And I'm just looking, first actually I'm going to provide hand hygiene and my gloves. Okay. Okay, and now I am just checking Mary's anatomy. Her perineum, I can see the swelling and where I'm going to insert it and everything. Now I'm just going to palpate your stomach, feel any of that swelling with the urine in the bladder. Okay, now I would just cover. Now I'm going to have a CNA come in, and I'm going to delegate the task for her to do perineal care. So she's just going to clean up everything before we go and put that catheter in, okay? Okay, so now I am just going to keep her exposed, and now I'm going to dispose of my gloves. And now if you want to switch sides, I'm going to come back into my patient's room after my CNA delegate care. I'm going to do curtain and door. Okay, Mary, hi, it's Grace again. I'm going to just lower your bed rail, and I'm going to raise your bed, okay?
Okay.
Can I just get your name and date of birth one more time?
Mary Sanford, 11/12/98.
Okay, and do you have any known allergies, Mary?
I don't think so, not that I know of.
Okay, and so you don't have any to latex or iodine or anything like that?
No.
Okay, so now see that she is exposed and everything, she's okay. So now I'm going to make sure that all of my stuff is set up. Okay, so now I am going to open my kit, not touching the inside, only the outside. Dropping that. I'm just going to take off this piece as well. Okay, now I'm going to take out these gloves, but I will be using these sterile gloves. And I'm going to put this here. Okay, now I'm taking my, first before I do my sterile gloves, I'm just going to put this trash can over here if needed. Okay, I'm taking my sterile gloves. Okay, not sterile yet. Okay, now I'm just going to open with my 1-inch border. Okay, just want to make that stay. There we go. Now I'm going to grab the outside and put my glove on, keeping sterile. Now I'm going to do the scoop. And I'm going to do my other hand. And now my hands are sterile and I'm keeping them above. Okay, now Mary, I'm just going to take these drapes and I'm just going to put them, Okay, so now I have my shiny side and I'm going to put that down. Keeping sterile field. Okay, now I'm going to take this drape. Okay, Mary, is that comfortable? Is that okay? Okay, now I'm just going to take my cup because I'm not collecting a specimen and putting that over there. And now I'm going to take my swabs. If I can get it open. There we go. Let it drop. I'm going to take my swabs out. I'm going to drop that. Now I'm going to open my lubricant. And now I'm going to lube my catheter. I'm going to put this in here. Okay. Now it is completely lubed. I'm going to put this back in there. I'm going to drop my lubricant. And now I am going to dirty this hand as I go to clean. So now I am opening labia and I'm going to do the far away cleaning. Dropping. And I'm going to do closest to me, going down. And then I'm going to do down the middle, making sure that everything is clean. Okay, and now as I keep this hand dirty and this hand sterile, I'm going to use just the inside and push this forward. And now I'm going to insert my catheter. For a female, I'm going to do this 2 to 3 inches. For a male, I'm going to do 7 to 9 inches. So now I'm going to insert until I get urine flow. And I do. Now I'm going to advance with urine flow. Okay, now I can pull this a little closer. Now sterile field is good because urine. Now I would let this flow for 15 minutes, taking off my sterile gloves. And now I can provide her with some privacy as we let that 15 minutes go. Then I would leave. I would come back, knock, knock. I would perform hand hygiene. And I'm actually going to put on another pair of gloves really quickly. Okay, hi Mary. I'm just back in here. Sorry, we're moving around a little bit.
That's okay.
We're gonna be taking that catheter out now, okay? Does that sound good?
That sounds great.
Okay, now did you have any pain or anything?
No, it feels okay.
Okay, that's good to hear. Okay, just gonna get this glove on. Okay. All sticky. Okay, now I'm just gonna expose right here, okay? One more time.
Okay.
Okay, now I'm going to take the catheter out. I'm just gonna slowly do that. Okay, now I'm gonna take this, and I would take these two, and I would dispose. Okay, and I would provide privacy, and I would put up the bed rail while also lowering. Okay, Mary, so I just want to make sure that you don't have any discomfort or anything after I took that out. Everything's okay?
Yep, everything feels good.
Okay, now I would go back actually and I would make sure that I would measure my output that I have of what Mary had out of her urine. And then I would also go and document of how Mary took the procedure. I would also do it of the amount of urine. I would document how much she got. And I would also document how the urine looked, how the urine smelled, the color, everything like that. And then I would also make sure that her bed is down, her SAD rails are up, and that she has her call light, and that Mary doesn't need anything else.
Nope, I'm doing good.
That is my skill.